We don't understand why it happens, but it does. And those left behind always wonder, was there something I could have done? September is Suicide Prevention Month. Dr. Victoria Kelly and fourth-year UTMC medical student Emily Cooper join us this morning. Good morning. Thanks for being here.
Good morning.
So I think this is something that so many people don't understand.
Yeah.
You know, it seems for those of us who we're feeling okay, we're feeling happy, you know, we get through our days and we're happy to be here.
Right.
We just don't, we don't understand, but this is something that is happening in the brain, right?
Yeah, and I think it happens a lot more than people think.
Yeah.
You know, around the world, suicide happens about every 40 seconds. Someone dies by suicide. And in Ohio specifically, it's the 11th leading cause of death, and first for those around the age 10 to 24.
Wow.
So
10?
10.
10.
Yeah, I mean, it's just really a very significant problem if you really think about it. But, you know, a lot of times when people are feeling that way, they really keep it closed off and quiet. So I think that what's important is that, you know, months like this exist, and because it brings attention to kind of, it's almost a silent killer in a lot of ways.
Yeah, yes. I mean, we want to make people feel comfortable with being able to talk about it.
Absolutely.
And there's this whole stigma associated with that. We want to talk a little bit about, we talked about how many people are affected. We want to talk a little bit about who is at risk here, because there are some risk factors associated with this. So Emily, what are some of the things that might set people up?
Yeah, so they actually find that people in caregiver professions are at higher risk. So that includes everyone from social workers to therapists to physicians, and even students involved in the mental health field. So it's important for students to know that they have resources through their university. And then also, studies have shown there are a few key symptoms that are indicative of suicide. So those are depression or hopelessness, anxiety or feeling panic, not being able to sleep or insomnia, and then psychosis.
So some things to maybe try to be aware of maybe in people in your life?
Yeah, so you may wonder, like, well, and it sounds like a silly question, but how do I really know if I'm suicidal, right? And so there's a couple ways to look at it, and one is passive and the other is active. So if you ever feel so down that you have thoughts that life isn't worth living, you wish you could go to sleep and never wake up, or something could just happen to you and you'd be fine with it, those are still suicidal thoughts.
Sure.
The active suicidal thoughts would be if you're actively planning or thinking about doing something to purposefully take your own life. And both of those, whether you're passive or active, really would be considered an emergency. So if you compare it to someone who maybe has heart disease, high blood pressure, you have chest pain, that's an indicator you probably need some evaluation immediately. So when people have suicidal thoughts or psychotic symptoms, those are indicators that you really do need to get help immediately.
And there is help available? Obviously.
Yeah, totally. There's help all over the place, both in the kind of nonprofit sector. There's support groups through National Alliance on Mental Illness. Most counties have their own groups. In addition, there's, of course, the American Foundation for Suicide Prevention, and Rescue Crisis is a local resource, but many counties have their emergency centers that you can go to. But the flip side is, besides those individuals who are actively struggling with this depression and this kind of deep despair, is the family members. So, you know, even if you have a family history of suicide, it still increases your own risk by 6 times. So you may be left wondering, what do I do? I don't know how to help, you know, my spouse, my partner, my child even. So I think it's very important in those situations also to get your own help, get your own guidance. There's a lot of books out there that can also help, but very important for that is, the take-home message is that you want to be a supportive presence so that they can get the help they need. And then, you know, what you say to them actually matters.
Yeah, they're listening, they're paying attention.
Yeah. So things just like, look, I'm here for you, and I basically just listen to them and allow them the space to vent. People feel a lot of guilt, you know, just about having those kinds of thoughts. But keep a non-judgmental, calm attitude, and, you know, actively ask So are you having thoughts about hurting yourself? Are you having thoughts about ending your life? And a lot of people are afraid to do that because they think it might plant the idea, but the research shows that is absolutely not the case, and by far people feel a little more relieved.
Okay.
That it's
someone cares, someone is asking.
Things that aren't helpful to say would be like, oh, it'll be fine.
Right.
You know, just
like you're not validating their feelings, what they're feeling. Yeah, you're just kind of brushing it off like it's not.
Yeah, and the last thing would be if something is really, really struggling, and you know, get them to help. So call 911 if you need to. You can ask for a CIT trained officer. It's crisis intervention. They've gone through some extra training to be able to respond appropriately in crisis situations.
So we take this month and we want to raise that awareness, and just maybe somebody in your life, this segment today might say, yes, I need to have a conversation with somebody and check in, and I need to do something too. So good luck to you. You're almost there, getting through that schooling, and thanks for coming in today.